Public safety meeting to order. Madam Clerk, would you please call the roll?
Alderman Boyd.
Present.
Alderman Ornowitz.
Present.
Alderwoman Hubbard.
Present.
Alderwoman Howard.
She was excused. Please.
Okay, so noted. Alderman Muhammad.
Here.
Alderwoman Boyd.
Here.
Alderwoman Clark Hubbard.
Present.
Chairman Vaccaro.
Present.
7 present, you have quorum.
So I guess first we're going to need to, the approval of the minutes from the last meeting, which is June the 26th. Do I got a motion to approve those?
I move to approve the minutes of Wednesday, June 26, 2019.
Second.
And we'll just all in favor. I don't think we have to do a roll call for that, do we? Oh, yeah, we do. Okay, roll call, please.
Alderman Boyd.
Aye.
Alderman Ornowitz.
Aye.
Alderwoman Hubbard.
Aye.
Alderwoman Howard. Alderman Muhammad.
Aye.
Alderwoman Boyd.
Aye.
Alderwoman Clark Hubbard.
Aye.
Chairman Vaccaro.
Aye.
7 aye votes.
So, and you know, if you want to come up and start presentation, I'd appreciate it, or whoever. And if you can just give us your name, because my memory's so bad, I forgot it.
That's okay. Serena Muhammad. I'm the Director of Strategic Initiatives for the St. Louis Mental Health Board. Okay. So you have before you a presentation, and I'm going to go through each slide. And I ask that if you have any questions for clarification, that you stop me, because I want to make sure that I'm communicating in a way that you understand every piece of the presentation. If you have questions for discussion, we'll have time at the very end. So there may be an opportunity as we go on through the presentation to answer discussion questions. I'm going to present for the first part, and then I'm going to call up Jessica Meyers, who's the coordinator for the Violence Prevention Commission, to talk for the second part. So the first part of the presentation really is for the purpose of providing context, data, and level setting on what we know about violence and violence prevention and the public health approach to violence. So when you look at this first slide, this comes from the Prevention Institute, which is considered an expert on prevention programs as well as violence prevention specifically. And the thing to take note of on this slide is that violence takes many forms. We're talking about violence that occurs against groups or community that results in injury, death, psychological harm. It's a multifaceted issue. The public health approach asks that we actually look at root causes of violence. So it's important to understand that there's a progression of violence. It starts out in many cases with looking at lower level crimes. So at the bottom of this slide where it says a public health approach, there's data that suggests that most folks who commit violence start off with small incidences like robberies and carjackings when they're younger. That moves into serious crimes with a progression into homicides. And the reason that that's important is because when you're talking about violence prevention, you need to understand the root causes and where you can intervene before it gets to the point of turning into homicide or shootings. So the next slide is preventing gun violence. And this is a quote from Dr. George Albee from the Prevention Institute, that when you think about violence as an epidemic, it's important to understand that you don't resolve epidemics by looking solely at the individual level. So it's not just about treating that individual, it's about paying attention to the environment and the community and the context and having a population level approach. So when we talk about a public health approach to violence prevention, we're also looking at community level strategies. So this next slide gives a definition of how we approach violence prevention, and it emphasizes the importance of having multiple partners. So as much as we would like to have one organization or one program or one solution, because the issue of violence is so complex, it requires that we work across sectors and across partners to really look at all of the drivers that actually affect violence. So this next slide is the social determinants of health, and it gives you the specific areas where you need to have strategy in order to really address those root causes of violence. The social determinants of health is something that is used often in the public health approach because we understand that in order to really address root causes, you're talking about addressing economic stability, education, neighborhood and built environment, all of those things that create the conditions that actually produce violence in the first place. So a comprehensive strategy must address all of those things. So the next slide on the public health approach. There are 4 steps that you take in a public health approach. The St. Louis Area Violence Prevention Commission has been intentional about taking each of these steps. The first is that you define the problem that you're trying to address. The second is that you identify the risk and protective factors that are directly related to that problem. The third is that you develop and test prevention strategies. And the fourth is that you assure widespread adoption. So anything that has been proven to work, you have to scale it to make sure that it reaches the population level. So I'm going to go through each of these steps because they're important to understanding how we arrived at the action plan that we're going to present today. The DOJ diagnostic report is where we define the problem. So the city of St. Louis invited the Department of Justice in to actually study the drivers of violence in our city. It's important to note that even though violence occurs across the country, there are unique contexts and situations that you really need to understand when you're defining the problem so that you can have customized solutions. The DOJ report was released in March of 2017. There's one slide on here that I included, but when you go to the full report, there are many graphs and slides with data on the specific drivers of violence in our city. The thing to note on this slide is that there is a comparison between St. Louis and 5 cities that are comparable to St. Louis. Those cities are Cincinnati, Kansas City, Memphis, Indianapolis, and Milwaukee. So we're looking at how we compare to those comparative cities as well as the U.S. And you can see that we've had peaks and valleys, but for the most part, our crime has outpaced, our violence has outpaced our sister cities. One of the things that the DOJ report did that was very important is it not only broke down the root causes and drivers of violence, but it also made specific recommendations that were tailored to addressing those root causes. So when you look at the slide on non-fatal shootings, there is an emphasis placed on addressing non-fatal shootings because they are predictors of homicide, because we have a lower than average clearance rate as it relates to non-fatal shootings, and because they affect predominantly youth under 24. So the Department of Justice called our attention to making sure that we had strategies that specifically addressed non-fatal shootings. And when Jessica comes up and gets into the action plan, we'll talk about what those strategies are. The next slide comes straight out of the DOJ report again, and it gives an example of the type of salient solutions that they offer. So they're looking at solutions that focus at community-level trauma, building positive relationships with police, improving responses to non-fatal shootings, and establishing partnerships so that we can work across sectors and address multiple issues. It's important to note that in this slide, there are enough strategies to keep everybody busy. So there's no issue around picking one activity or one organization or one solution. There's a lot that has to be done, and the DOJ called out the importance of coordinating and aligning all of the work so that we're all moving in the same direction. You can skip over the next 2 slides. I included them so that you have it in front of you, and it gives some specific recommendations that the DOJ made in 2017. But I want to land on the 4 priorities that they gave us. The first one, it says Factor 1, community responses to youth violence. This slide is specifically focused on what the city can do. So even when you look at our available resources and city services, the DOJ has recommendations on how we align the resources that we have and how we reorganize some of our activities so that we can start addressing these root causes of violence. I've highlighted, or I've put in bold, focusing specifically on the social cultural environment, physical environment, and economic development. All of those things are important drivers to addressing the root causes of violence. The second slide focuses in on strategies to reduce gun violence. And this is where the Violence Prevention Commission does most of our work. So it's around linking organizations and resources that already exist in community who are eager to jump in and help with strategies that have been proven to be effective. So this is where we focus most of our energy, on collaboration and relationship building between those organizations and convening towards one action plan. The next slide talks about community police relations. VPC has been working in partnership with the St. Louis Metropolitan Police Department, specifically Captain Perry Johnson in the 6th District, and we believe that those strategies will have the long-term impact of improving relations, which will ultimately drive the police's ability to actually implement community policing in a way that the community resonates with. So there are some things that can be improved and repaired, and the police have been very willing partners in figuring out how to do that, especially in the 6th District. And then this last slide talks about community and social services. So as an organization, the St. Louis Mental Health Board is responsible for administering funds for mental health services. That means that we work with a lot of organizations in the city of St. Louis. We have institutional partners like the United Way, like Washington University Institute of Public Health, each of which have their own networks of organizations. So one of the things that we focus in on is building a collaborative table so that we can bring all of these experts together in one space to drive a coordinated strategy. And that's an important thing to keep track of because we need to have trauma-informed approaches, we need to have evidence-based practice, and we need to have people on the same page about how to do these things together and move forward. So all of that goes into defining the problem, really understanding what it is that we're dealing with and how to address it in the city of St. Louis. The second thing that we did was identifying risk and protective factors. So what are some of the things in our community that are inherently contributing to risks to violence, and what are some of the protective factors that we need to build up? So for this, we partnered with George Mason University. They came in and they did an assessment of the social service providers that we have in our region who say that they work on violence prevention. It was important for us to understand the capacity of who's here, how effective they are, and what supports they need to do even more than what they might be doing. The slide R&R data sources just tells you who we worked with to get some of the information that we did for this report and what was assessed. There's a slide that has 4 very small graphs on it. You don't need to necessarily be able to read all of the points on this slide. The major takeaway here is that it's coded in 2 different colors. One color shows what is needed by this population, and the population is labeled on the top of each graph. The other color shows what is available. One of the challenges we have is that we fund or overfund programs that are not necessarily needed to address violence, and we underfund programs that are needed. So there's an opportunity to shift where we're directing our funding, and that's in the public sector as well as the private sector. For example, one of the programs in the other category is conflict resolution. What we found is that there are a lot of organizations that offer conflict resolution, but according to the evidence, conflict resolution is not the most effective strategy to deal with violence. They actually suggest programs that focus more on decision making and life skills. So the risk needs responsivity report gave us, yes?
Real quick, I'm having a hard time interpreting the slides, so can you just go through one and give us an example? We're on page
Yes.
21.
So let's start with the Exhibit 1, General Adult Population Gap Analysis. So the dark blue color shows you the need. So this is the percentage of people who need the particular service that is labeled on the axis below.
Okay.
The light blue shows you what's the current capacity. So ideally, both of those would line up. We would need 60% and we would have 60%. But what we have instead is a need of about 45%, for example, for life skills, and then the actual availability is less than 20%. And then when you go further down that graph and you get to other, you'll see that the need is much less than what we actually have. And that just shows us that we're funding a lot of programs that are not directly designed to address the problem that we're trying to address. And when I say we, this was a program that an evaluation of about 112 organizations that voluntarily contributed information. They're all over the region, who say that they work on violence prevention. So some of them are funded by the Mental Health Board, some of them are funded by the United Way, some of them are funded by government. There's a range of organizations that reply to this survey, but it gives us an idea of, what they believe they're doing versus what's needed for the population that they're trying to serve.
Okay, let me just go back to Exhibit 1.
Are we taking questions right now in order, or are we just, what are we doing? Because I have some questions as well before we get too far out.
Oh, so we can't, well, after Jeffrey, if someone has questions, certainly we can ask at any point through this. It's just a presentation.
Yeah, what she had stated earlier was, you had a question about something, go ahead and ask before we get to the
I have
end.
some questions too.
Okay, so I just want to make sure I'm interpreting Exhibit 1 correctly again. It says 44% is the need, and right below it says 7% life skills capacity.
Correct. So that means that there are 44% of the people that we're trying to serve need a service that's only available to 7% based on the capacity of organizations. So that's one area where we could say if we invest more in life skills, we would be closer to meeting the need of that 44%.
Okay, thank you.
Yes.
I'm sorry I had stepped out, but I just have a quick question briefly. Can you give us an overview on who you are, your organization, how this data was compiled, and by whom?
Yes.
And what your premise is for being here today and what you hope to accomplish by giving us this presentation?
Sure. So my name is Serena Muhammad. I'm the Director of Strategic Initiatives for the St. Louis Mental Health Board. We are a taxing authority that provides mental health services for city residents. We provide support to the St. Louis Area Violence Prevention Commission. So you'll hear me say VPC just to be shortened. VPC has been established for about 2 years. It was originally convened by Washington University and United Way. We brought together social service providers, law enforcement, institutional partners to figure out how to address violent crime in our region. We started by looking at the data and the research that already exists. So as I mentioned, in 2016, 2017, the city of St. Louis invited the Department of Justice, the U.S. Department of Justice, to do a study on the drivers of crime in our region. So that DOJ diagnostic report that I referenced at the beginning of the presentation all came from them. There's a full link to the report. There's a link to the full report on the City of St. Louis's website. So you can see their methodology, who participated in the evaluation. They presented their findings in March of 2017 to the city, to the police department, and to social service providers. And the Violence Prevention Commission decided to use those findings and recommendations as the basis for our action plan and our strategy. The other report that I was just talking about is the Risk Needs Responsivity Report, and that was something that we did to understand the risk and protective factors in our region, so what our current capacities are with the social service organizations that already address youth violence, and that report was done in partnership with George Mason University. So they sent in Dr. Faye Taxman to actually do all of this data gathering. We had community meetings at around this time. This report was actually released in 2017, and then there's one more report that we did in 2018 that Jessica's going to talk about that helped inform our overall strategy.
Okay, thank you.
Mm-hmm. And to your other point about why we're here, I think we operate under the premise that we like to work with a coalition of the willing, and we've been working for the past year with more than 100 organizations who are really working together to figure out how to address violence. I don't consider myself to be a highly visible person. I'm kind of behind the scenes, so we've been working on this, and we're at a place now where when we hear people say that the city doesn't have a plan or nobody's working on this, then we take that as an opportunity to introduce ourselves so that we can offer support as needed or invite people to work with us if they choose to.
Thank you. I definitely appreciate that. But I just found it kind of unique because in me being on public safety, I've seen some organizations come in. I know it's crime is definitely an issue for everybody right now, but I know like we have different criminology departments. UMSL's criminology department with a lot of major experts are ranked number 4 in the nation. And so and maybe this is a question for the chairman, I didn't know kind of like where we were going with this as far as having people come in and offer us direction in regards to how we address crime.
Well, they actually talked to me, and I know they talked to Jeffrey. And it's kind of unique because it's funded by the state.
Okay.
My understanding, they've already done work in Pam Boyd's ward. It gives us an opportunity to call on them to say, hey, this is what's going on in our neighborhood. And they have the wherewithal to get us help in different directions. They're not, as far as I know, I don't think they're asking for suggestions from us. I think they're wanting to help us. I think they're here to say there is a plan.
I understand that. You don't have to sell me on it. I was just
Well,
curious.
it's not selling. It's
Yeah,
just,
I was just curious as to, like, because I had never seen an organization just come and present before. We've had some, but I just didn't know where we were actually going with this presentation. So that's all.
when they talked to me, I thought this is so good that, I wanted to kind of get this in an open.
Okay.
Because as a group, we're going to be tackling all kinds of stuff. And I know I have the cooperation of Larry, who's the head of the health department, and I'm glad he's on this committee. And we're going to be tackling, some really tough issues as far as violence. And how do we as a group, over the next 2 years while we're a group, get this together. And we have a really great committee. I mean,
Right.
Thanks. I'm sorry, John, you had questions?
I did. Thank you, Mr. Chairman. Thank you for presenting this presentation. I just have one question in regards to your exhibits that you have here on page 21. Right now, there's a lot of talk about cure violence and them coming into the city of St. Louis to hopefully reduce crime. Are you familiar with cure violence at all first?
Yes.
Okay. Now, based on your graph that you have here, is cure violence an appropriate model for St. Louis based on this graph that you have?
So let me answer that this way. If you think about the continuum of services that need to happen, all the way from promotion and prevention to treatment, which I would consider interruption, then there is a space for programs like Cure Violence. When it's a part of a larger plan, I don't think that one program by itself will address the issues that we have in the city, because they've been with us for a long time and they're complex, and we need to have multiple strategies to address all of the things that are driving violence in our region. If there's a spectrum, I would say Cure Violence is on the end of the spectrum. That's when you're working with folks who have already kind of been engaged in a violent act, and that's an important place to intervene. But there's also a prevention component at the very beginning, where you're looking at economic mobility, you're looking at other things that contribute to violence. So I think we would be setting Cure Violence up and ourselves up for failure if we put everything or all of our eggs in one basket. We really need to be as comprehensive as possible, and hopefully Cure Violence will be a part of a comprehensive approach. Did that answer your question?
It does. But and do you think Cure Violence will be successful at all if the collaborations and partnerships are set in place for it to be?
Mr. Chairman, I'm just going to interrupt. I'm not sure if it's appropriate to put Serena on the spot to give expert opinion on whether a program will be helpful or not in her official capacity. I think it could potentially cause more harm than good for her to answer those type of questions.
Mr. Chairman, if I may, and Mr. Vice Chair, I respect that. However, I'm just asking for her professional opinion because she deals with this area of expertise. I was only asking for her opinion. I was not asking for as if she supports it or if she does not.
Right, and I'm comfortable.
But I yield back my question. Thank you, Ms. Muhammad, so much.
Okay.
So.
I yield back. I'm fine.
Just a quick answer. Next Tuesday, we're going to have a meeting with the funding and with Cure Violence. So they'll be in here next Tuesday. I know we're doing a lot of meetings, and but I already, we're going to discuss the board bill that was put out there by the president of the board, and we're going to have the Cure Violence people come in and. I know the board bill's asking for $8 million, which seems a lot to me, but I figure we'll get into that next Tuesday. And between us, we'll come up with some sort of a good answer, I'm sure. Thank you, Jen. I appreciate your input.
Thank you, Mr. Chairman.
And I only have 2 more slides before I call Jessica up, so you... So just to wrap up the risk needs responsivity recommendations, you'll see that there are 4 areas where they ask us to focus. One is a focus on violent offenders. So there are programs that are designed specifically for this population, and what they suggest is that we make sure that those programs are offering decision-making and self-management skills. The other is to improve program quality. We have a lot of organizations who are working in this area because they care about the issue, because they've been personally impacted, and they don't always have the time or the space to really look into what evidence-based practices are already out there or to conduct evaluations of their own programs. So we position ourselves to be able to help organizations who seek it to improve their program quality, to make sure they're as effective as they possibly can be. The report also talks about a need for better data measures. We don't have standardized data across the field, so people are measuring success differently, and it would be useful if we all had an agreed upon definition about what success looks like and how successful organizations are, so that we can really start to prioritize where our resources go. And then the last, of course, is just implementing these effective strategies. And I included one slide that gives examples of specific strategies, whether they're for individuals, whether they're criminal justice, school-based, or community initiatives. Because again, we have to work across spaces and sectors to really get to this issue. So I will yield now to Jessica Meyers, who is the coordinator of the Violence Prevention Commission, to wrap up our presentation.
Thank you for allowing us to present to you today. As Serena mentioned, my name is Jessica Meyers, and I'm coordinator for the St. Louis Area Violence Prevention Commission. So I'm going to start with step 3 of the public health approach, which is to develop and test prevention strategies. Earlier, Serena mentioned the DOJ diagnostic report, and one of the interesting slides that was part of the DOJ report was this graph of homicides in the St. Louis city. And if you notice, in around 2003, there was a marked decline in homicides. And so when this was presented, the question that Serena posed and that we investigated further was what was going on in the St. Louis region around that time that might have contributed to that drop in homicides. And so we worked with the Institute for Public Health and their gun violence initiative at WashU to come up with a background on what violence prevention strategies were going on around that time. And so Tamsin Reed, who was the researcher, along with the help of several interviewees, came up with a timeline of exactly what was going on in the area. And so she identified several violence prevention programs that were going around that time. The Ceasefire Group and the Gang Task Force, Search and Seize, and Strategic Approaches to Community Safety Initiative, or SACSI. So Search and Seize was one of the more effective ones that started off. It started in 3 phases. The first phase allowed for community tip-offs. If someone believed that there was a house where a juvenile might be hiding a gun, they could go to police. Police agreed not to prosecute the juvenile or the family for having that gun. And they actually went through and seized 402 firearms just in the first year. They would go to the door, knock on the door, say there had been a tip that there might be a juvenile that was hiding a gun. 98% of households that they knocked on the door allowed the police to come in and to search that house. They were doing between 5 and 30 house searches every night during that first year. And again, they took more than 400 firearms off the street in that first phase. Between phase 1 and phase 2, there was a change in leadership. There was also a change in strategy. The goal shifted from seizing weapons and getting them off the street to increasing the arrests of juvenile offenders. So while the first phase involved a promise that no one would be prosecuted for possessing the gun, this phase did not. Phase 2 only operated for about 9 months, and only 6% of the guns that were seized in phase 1 were seized in phase 2. So a dramatic decline as the strategy shifted. Phase 3 relied on police intelligence. The granting consent fell from 98% of houses they knocked on the door in phase 1 to only 50% in phase 3. The number of guns seized was almost 90% below the 400 guns that were seized in phase 1. So even though it was the same program, it had vastly different implementation across its phases. SACSI had several components. The first was to focus on the most violent offenders, and this is something that we have seen repeated in the DOJ diagnostic report and the risk need responsivity report. Focusing on the most violent offenders is very important. Also, they focused on hospital trauma intervention. This was one of the early programs that really looked at improving communication between hospital staff and police when people are coming into the hospital. It also included targeted intervention for those people that were admitted to the hospital. This only was around from 2000 to 2001, but that has been revived through Life Outside Violence, which is the hospital-based violence intervention program that's currently operating in the 4 level 1 trauma centers in St. Louis. Also, there was a specific intervention in the 5th district. We know that crime is very spatially and geographically concentrated, and so this was an effort to really focus in on that geographic concentration and the geographic factors in the 5th district that might have been contributing to crime.
Could I ask a question, please?
Yes, ma'am.
When you talked about, thank you for coming.
Absolutely, thank you.
When you talked about the initiatives that have been kicking off in 93 to 95, and so at that time, I don't know if a lot of people in this room probably were babies, so they don't remember. Us older people do remember this. So at that time, it was a community in my ward that they called Murderville. And these initiatives were kicked off in our area. And so it was with Beacon, Alcott, and Davison. Mm-hmm. And so I guess my question is, and I'm a person that I figure if it's not broke, don't fix it.
Yes.
So what I'm hearing from those initiatives at those times that have reduced the crime at the level that it did, is that what we're looking to go back to? Because from Ms. Muhammad's statement, it seemed like we're trying to, and I'm happy about it, to go back to partnerships in the communities, because that's the way we can reduce the crime.
Yes, absolutely. The focus is on partnerships. It's also from learning from the past. So the old trope about if you don't learn from the past, you're doomed to repeat it.
Right.
We can learn a lot from what has and what has not worked in the city of St. Louis in the past.
Okay.
So this is not to say that we want to do these specific programs again, but we can learn from how they developed, how they changed, and eventually how they were phased out.
Okay, thank you very much.
Thank you. So the key takeaways from all of these programs, the first is that leadership is always a vital component, but leadership is best when it's done from a coalition and from a community. So one thing we saw, for instance, with the search and seize is that it was one leader's program. When a new leader came in, the decision was made to change how it was implemented. So allowing a program to have longevity and sustainability is about leadership, not being just one person, but a coalition. Willingness to cooperate among and within agencies, so sharing the responsibility, the information, and the resources. And funding that aids collaboration. We are not here to ask for funding, so I just want to put that on the table. But I do know that in the future you will be making funding decisions with Proposition S and other proposals that you may have. So please consider learning from what we've done in the past with how you're giving out that money in the future. So on assuring widespread adoption, this is where I really want to get to who we are at the Violence Prevention Commission. So we are a regional initiative. We cover St. Louis City and St. Louis County. We think it's important to be regional because we know that crime does not stop at the border of the city. Many things that happen in the county move to the city. Things that happen in the city move to the county. Our jurisdictional boundaries do not deter crime. We also have members from a variety of sectors. So we have community organizers, community residents, employment and workforce development, healthcare, policy and advocacy, research, and social service providers. Many of these agencies don't necessarily have a violence prevention program. But what we know and what we try to communicate is that workforce development is violence prevention. Education is violence prevention.
Right.
Healthcare is violence prevention.
Right.
Importantly, we also have traditional public safety groups such as the St. Louis City Police Department, the Corrections Department, and the courts that also participate in the Violence Prevention Commission. Although we take a public health approach to violence prevention, we recognize that public safety must be at the table for all of those discussions. So we have approximately 60 member organizations that have signed member charters and participate on a regular basis. We have more than twice that in agencies that we can call on to help us to live out the strategies that we have. We have several members here that are members of the Violence Prevention Commission, members of our Leadership Council, and have taken the time to come here to show support for what we are doing and what you're doing as a Public Safety Committee. You have an overview of the Violence Prevention Commission timeline. We talked about the DOJ diagnostic report. We've talked about the Risk Needs Responsivity report. We formed our Violence Prevention Commission Leadership Council in 2018 in January. In August 2018, the St. Louis City and County Health Departments and the hospitals in the area completed their Community Health Improvement Plan. One of the priorities identified in that plan was violence prevention. The Violence Prevention Commission is the action team lead for reducing violence as part of the Community Health Improvement Plan. In September of 2018, we adopted our action plan, which you all have in front of you. That's the table with the blue bars on it. And then in December of 2018, the Youth Violence Prevention Partnership, which is one of our member agencies, created their Safe and Thriving Community Strategic Plan. Marcel will be providing copies of that plan to you today. So as Serena mentioned, prevention is a spectrum. So our action plan crosses all parts of prevention. Promotion is just to raise awareness of what the Violence Prevention Commission does, what strategies we have, and to be an advocate for including the Violence Prevention Commission in the conversations that people are having about violence prevention. When we actually get to prevention, there's two types of prevention that we want to focus on. The first is universal prevention. Universal prevention are those interventions that make entire communities safer. Selective prevention is focused on those at highest risk for being a victim or a perpetrator of violence. And then intervention is where you actually work with someone who may have been the victim or the perpetrator of violence. Again, our action plan works across this spectrum. Traditional spectrums also include reentry for people who have been perpetrators of violence. We do not include that because there is the St. Louis Alliance for Reentry, the STAR, and they are working very effectively to create plans for reentry. So our action plan, based on all of the plans and the decision-making you've heard and listening to what the community said, we came up with 3 objectives. The first is to improve the community-level response to non-fatal shootings. The second is to advance trauma-informed and evidence-based violence prevention. And the third is to activate communities to strengthen police legitimacy. So I'm going to talk about a couple of those. The first is the community response to non-fatal shootings. As Serena mentioned, the DOJ diagnostic report identified non-fatal shootings as an intervention point where we can interrupt that cycle of violence from potentially becoming more serious. And so as part of that, we have tried to create a community response network for victims of non-fatal shooting. We have partnered with 3 victim service agencies that work with all of the non-fatal gun violence victims for St. Louis City. That's Life Outside of Violence, the Hospital-Based Violence Intervention Program, the Circuit Attorney's Victim Service Unit, and Crime Victim Center. We made sure they were all sharing information, and from there we talked about what are the biggest unmet needs. What are those needs that a non-fatal shooting victim might come into your office and say, I really need help with this, and you know that you're just not able to, off the top of your head, come up with a resource. So some of the things they mentioned were mental health care for trauma, employment, utility assistance, relocation assistance, and help with property damage. So we brought in the United Way, which is one of our great partners, their 211 program, and we have collected a group of resources. From there, we opened up to mental health service providers, and 3 mental health service providers have signed on to be part of this network and to take victims of non-fatal shootings, whether they need trauma-focused therapy, cognitive behavioral therapy, or psychiatry. We also have Employment Connection that has agreed to connect non-fatal shooting victims and their families to employment opportunities. Alderwoman Boyd, do you have a question?
I'm sorry.
Not a problem.
But I hear what you're saying, and it sounds great. I guess the challenge is when you're involved in these situations, and me as an older person in the ward, I'm involved, and when you have family members that is not the non-fatal but the fatal and have lost family members, and it's real interesting because all of these people you called, the families are saying, I need help. And so my question is this some booklet or director or something that gives to me to say, you can go to these people or whatever? Because I'm hearing the family members crying out, and I don't know how to get them to help.
So for fatal shootings, the best first stop would be Crime Victim Center. They help victims of any type of crime in St. Louis City and St. Louis County. They do have some grief therapy, but they can always make sure if they're not able to offer assistance that they can get them to someone who can.
So
they're also part of the Homicide Ministers and Community Alliance.
But do you have a number or something?
Yes, I can give you that number.
All right. I just need the information so I can pass on.
Yes, I will follow up with you to give you that information.
Thank you.
Absolutely. So we soft launched this community response network on September 1st. The United Way, for the first time through their 211 system, created a specific intake for gun violence victims. So we will be able to track how many people that are calling United Way 211 for assistance are calling due to gun violence. And we'll also be able to track where they are referred, what needs they have, what unmet needs they have, and how they're referred to the mental health providers. Hopefully, within the next few months, we will be able to start offering assistance for relocation as well as property damage, but those have not been brought online yet.
So, maybe
Yes.
I wasn't following it as well. So, they dial 211 on the phone, so if a constituent or someone that simply dial 211 and
Yes.
they will help them? Okay.
Yes, you dial 211, you'll be connected to the United Way, and then if that constituent says they're a victim of gun violence, they'll be given the gun violence intake. That information will then be sent to all of the victim service agencies. So if that person doesn't call directly, that victim service agency can follow up. Because we know with trauma, there's sometimes an inability to follow through on calling numbers.
Okay, what about, just because we're going to be talking about this Thursday, one of the bigger issues with homelessness is probably going to deal with mental health issues.
Yes.
So, is there help for them? Or
There
they have to
is,
reach out
but
for-
I'm not the expert on exactly what services are out there for homeless individuals. If they are a victim of non-fatal gun violence, then they could come through this system, but they can always call 211 as well. So 211 is not specifically just for gun violence victims. It's a referral number for anyone in the community who might need help.
Thank you.
Sure. So the second thing that we're working on is strengthening police legitimacy. Sometimes when we come to groups and we say police legitimacy, people don't know exactly what it is we're talking about. So what we're talking about is the degree to which citizens believe police are honest, respectful, want to do their job, and want to protect citizens from crime and violence. That's the basic definition that we're working from. In strengthening police legitimacy, however, we want to center that focus on community. Community needs to define what it is that they see as community policing and legitimate policing. It's not necessarily for the police department to come in and say, this is what we're going to do in your neighborhood. So we have tried to infuse community voice at all stages of this process. So we've convened 4 community policing events where we go out and we have an open invitation. We have a facilitated discussion of 4 questions. What's working in policing? What's not working in policing? What parts of community policing would you like to see more of? And what are your hopes or fears for a combined city-county police department? So we have all of that information from those 4 events. Our Policy and Systems Change Committee co-chair suggested we ask those same questions to police officers. And so we have now done some stakeholder interviews with police officers to ask those same questions.
What you have?
We've also done canvassing. Last year we canvassed primarily in the 27th Ward. This year we extended over the city-county boundary into Jennings. One of the things that we have been doing with canvassing is not only letting people know about United Way 211, letting people know about the Violence Prevention Commission, but also offering to them opportunities to build capacity and to engage in further conversations about community policing. To that end, we offered a series of 4 free workshops on neighborhood leadership training for individuals who live in St. Louis City and St. Louis County. We are getting ready to host the 4th of those 4 trainings next weekend.
So where are they going to be held at? This is the first I heard, that's why I'm asking.
Sure, so we've held them in different places. We wanted to have them across the area. We had one at the Gary Gore Community Center. We had one at the Walnut Park Library. We had one at Missouri Foundation for Health. And the last one is going to be at Deaconess Center for Child Wellbeing.
And so how was that marketed?
So we mostly market it on social media and by our partners sharing it through their networks.
Okay, so for the people that don't have that access, how would they know?
Yeah, so we're looking at options for redoing that. In our first class, we could only have up to 25 people, and honestly, it filled up within probably 3 or 4 days of when we released it. So it wasn't something that we were looking at beyond that. But if we do choose to do these again in the future, then we will look at additional publicity options that are outside of social media.
Okay.
What if any particular alderman would want you to come to a neighborhood meeting where they can organize people in the neighborhood? Because although we're going to be tasked with trying to get this out, and, you know, I'm lucky because my neighborhood isn't going to have the same problems as some of the other people, but what's the willingness of that group to come, like, say, for instance, Pam or Jeffrey or Shameen or someone would call and say, we would like you to come to our neighborhood meeting, which is more ground level.
So we would be open to coming to bring information about the community policing and the police legitimacy survey. It would just be a question of bandwidth to make sure that we have staff coverage for that.
Okay, thank you. Oh, yes, go ahead.
I'll hold my questions for when.
All right. So as part of the community policing events, we also distributed a police legitimacy survey. It's 24 questions from strongly disagree to strongly agree, plus 1 open-ended question. We also put that online for people that are not able to come to our events. Our ask is for you to share that through your networks. You should have flyers. We brought flyers. We also have the bit.ly VPC police survey link. We want to get as much coverage of the city and county as possible. Again, an opportunity for community voice to be part of the discussion on community policing. From there, we'll take that information. It will go to our Policy and Systems Change Committee, which will design evidence-based, community-informed policy suggestions for law enforcement. We'll take that back to community again for listening sessions to make sure that we got the message right. From there, that will be given to law enforcement. So that's another opportunity for community to engage in our Violence Prevention Commission process. The final process that I want to talk about is the Youth Violence Prevention Partnership. As I mentioned, YVPP is one of our committees, but they existed even before the Violence Prevention Commission, and they were originally housed out of the City Health Department. They were awarded a Safe and Thriving Communities grant, and from that, they created a 5-year strategic plan for 2018 to 2023. Their outcomes that they're looking for are increased safety, well-being, and healthy development for children, youth, and families, prevention of violence and promotion of healing in homes, schools, and community, and reduction and sustained reduction, not just temporary reduction, in youth violence, specifically gun and gang violence. As part of their plan, they held several youth cafes. They had youth that were trained to be facilitators that hosted 7 youth cafes and got input from over 100 youth at those youth cafes about their view of public safety and what they would like to see to make them feel more safe. So on the slide you see some of their suggestions, some of their plans. Increase availability of safe spaces. They have funded some calming rooms in St. Louis public schools, not only for youth, but also for teachers. Supporting enhanced neighborhood and community-based organizations to rebuild social cohesion. Advocating for better coordination. Again, VPC and our committees align and convene. And fostering positive interactions between community and law enforcement, and implementing a sustainable framework for youth violence prevention. While they made a 5-year strategic plan, the actual funding for the grant is only 3 years, so sustainability has been an issue that they've been focused on since the very beginning. And again, Marcel from Ready by 21 and the Safe and Thriving Communities grant will be providing you a physical copy of their plan. The last part of what they have been doing is a community safety dashboard, and I have the link here. This is a tool that not only has information on crimes that are committed, but also takes a holistic view of community to look at those social determinants of health that Serena was talking about earlier. The dashboard's available to anyone. We believe it will be particularly useful to decision makers and policy makers to give context for decisions around violence prevention and youth violence prevention in St. Louis region. So any questions, comments, concerns?
Jessica, I have a quick question.
Yes.
Out of curiosity, you had mentioned that one of the survey questions was whether or not St. Louis City should combine with St. Louis County Police Department.
Hopes and fears for a combined city-county police department,
Fears.
yes.
So is that an open-ended question
Yes,
on the
it is.
survey?
That part's not on the survey, that has been in the community events, and so it was a facilitated discussion in small group settings.
And what brought about whether or not you should ask that, or?
So the first event that we planned was in January of 2019. Unbeknownst to us, about 3 days before was when the Better Together plan came out. So we knew that the Better Together plan was coming out. We knew that there had been conversation for more than a year about exactly what consolidation of the city and county would look like. So we wanted to know what community opinion of that was. After the Better Together plan was rolled back, We still know that there are people that are discussing the potential for that, and so we felt it was valuable to keep asking that question, to have community voice in case there's another proposal in the future.
So out of curiosity, because there's probably 30-plus different police departments within St. Louis County, right?
56 total between St. Louis City and St. Louis County.
56, and then St. Louis County itself. So is the question framed whereby everybody, period, dot, all 56 plus St. Louis would be combined, or just St. Louis County and St. Louis City?
It's open for interpretation, and so some people have expressed preference or hopes and fears if the municipalities remain, or if there is a full contraction to one police department and no municipalities. So that was left open to the interpretation of the people that are answering the question.
Interesting. Open to interpretation.
Yes.
Gotcha. Okay. Thank you.
Thank you. I just have some comments, and just to like piggyback off what my colleague from the 22nd just said, that's why sometimes we often have a problem with surveys and research, because when you pose questions like that to the community and they don't understand where things are going in totality, it kind of muddies the water a little bit, and that's very concerning to me, because with the whole Better Together stuff, that's something that a lot of my colleagues and I were definitely against, because African Americans were left completely out of that process. But just going back to some of the things that I've heard you discuss, and don't get me wrong, I thank you all for coming, and I appreciate data and research. I know you don't touch this type of work unless you actually have some passion for it. But when you look at trends and you look at data and you try to expound on what you may think was the cause of this or that or whatever, it sometimes it's a stretch in certain ways, because if you study criminology like I have, sometimes data can be skewed. And when you talked about what was going on between 93 and 95 and what was going on, okay, we had the crime bill in 94, which happened at that time, and that can invoke a lot of change on what, and we probably didn't see the impact of that until maybe 2003 or something. So I always question data and how it's brought about. And then when you said 402 firearms were seized under this particular program, and I'm not saying that's not true, but I can't think of 400 households in my ward that will permit you to come into their home without a search warrant, even if you say that you're not going to prosecute or whatever. So I question stuff like that. And just overall, I appreciate you all coming. I can say that as a body, and especially as a public safety committee, we are not green to this process. We know it takes a holistic approach to address crime in our city. I don't think never before have we had so many hands on deck with a breadth of knowledge by way of our Director of Public Safety and our commissioners over our Corrections Department, people who have decades in criminology and criminal justice, who know what it takes, but realize that we're dealing with a situation we've never seen before. We're seeing a past onslaught of ailments in our community by way of lack of development, lack of investment, lack of jobs, lack of resources, drugs, everything. So we're seeing that. And so as a body and as a Public Safety Committee, and especially as a member of the Black Caucus, every decision that we make, whether it be development, minority participation, jobs, workforce, we are looking at like the root causes of crime. And I'm a firm believer that poverty does cause crime. And so when we go into our communities and we look at like what the needs are, trust me, from top to bottom, when we're making these decisions, we're seeing how we can address it. We know that there's a disconnect in our community. We know the people that are most underserved, who you would need to get the data from, aren't going to take out time to fill out these surveys. They're not even coming into those settings. So it's probably not truly representative of what the true needs and problems are within our community. And so I just always caution us when, you know, we have organizations come before us and they put all of this data out there that's commonplace in academia, and it's research, and I know things are good by research, but when we're living it every day and we're dealing with it every day and we're walking out our doors, seeing our drug-infested community, seeing babies being slain in the street, we are aware of what's going on. And although we welcome input, but it's not like we're not trying to figure this out. And so, like I said, I thank you all for coming on. Research is definitely needed, but I can say that we know that it takes a holistic approach to address our crime problem, and I get it, you all conducted the research, you all started, you know, working with other organizations to see what's being done and what's not being done, but even when you look at you mentioned the Prop S dollars, we're just not throwing candy out the window. We're looking at organizations, token organizations in this community. We're right now we're saying, okay, where's the number? Where's the results? Show us. You say you do all of this on paper. Show us what you're actually doing, because it's not connecting. And so I just want you all to know that we are going above and beyond to try to make sure that we're allocating resources in the right manner by way of legislation and the limited power and control that we do have to address crime in our community.
I want to respond that I don't want you to believe that we don't think you know this, or that you're not doing your job, or we're trying to tell you what to do. We're literally just here to say that we've also done some work and we'd like to contribute and we'd like to help. And we have spent time in community to help inform our strategy. So we would never take something straight out of a report and say, this is it. You know, we live in these communities too. We experience the same things, and we talk to community members. When we knock on doors, people let us in and they talk to us because I think folks are frustrated and they're looking for support. So we're here to be a support. We're not diminishing the work of this body or any other group, but we're hoping to be additive so that if we work together, we can get even more done.
Thank you. No further comments, Mr. Chairman.
That's fine. Go ahead.
Thank you, Mr. Chairman. I want to thank you for today's presentation. I really appreciate it. I just have a couple questions myself. I mean, it's no secret to anyone that poverty causes crime. My question is, what is the dropout rate of kids in high school? That's one thing. I personally feel the school system has failed our children in many ways. My theory is if you have a child from the age of 6 to 9, you get them up at an average of 6 o'clock in the morning, feed them, dress them, then you got to get them to the bus stop, then you got a 45-minute ride to school. I'm sorry, but at that age, your attention span's gone for the rest of the day. The other thing is, we know we need to get more kids involved in programs. They have to have somewhere to go and feel like they're in a safe place where they can learn a skill, try to find employment so we can keep them off the streets. I think that's a big thing. Let's be honest, a lot of these guns on the streets are stolen out of cars from people to go to events. They can't take them inside, so that's why you have the car break-ins in the lots. How do you address that part? I don't know. There's a lot of things, when I was growing up, I don't know if it's a lack of resources, money, funding, or the state really just doesn't seem like they want to give towards education as much anymore to me. We have some schools that's been closed for years. Why can't we invest back in a couple of them schools and open them back up? I mean, why let schools sit there vacant? We have the charter schools now. So if I run a charter school, I get paid by how many kids I get enrolled. So, there's a lot of things, if we could wave a magic wand, my question keeps going through my mind is kids killing kids. Mm-hmm. And I mean, I don't know the answer. I don't think anybody really does. You know, kids don't have no, a lot of kids don't have no mentors out there. They really don't have someone to look up to. A lot of kids have absentee fathers, which is bad for them. You know, I've always known you got single mothers out there that have 2 and 3 kids who work 2 and 3 jobs every day to provide a roof over their head, be able to pay rent, buy groceries, you know, send them, get their stuff for school. And a lot of times, unfortunately, when that mother is working, sometimes she really doesn't know where her child's at. So they're on the street, and you know, the older kids out there, well, see, your mom's not home, she's not worried about you, you know, you need to be with us, we'll take care of you. So, I mean, it's a lot of things out there, but I appreciate what you do, and I appreciate that the state is giving you money. And you say now you have 3 mental health places that is going to help.
Yes.
That's good. So, I mean, I don't know what the answer is, but I'm willing to work with anything at this point. But, you know, I think a lot of this, and I'm not just putting the blame on the state, but our school system, and I think I'm not the only one that feels that way, has severely failed our children somewhere along the way. So.
And to your point, in the Youth Violence Prevention Partnership Strategic Plan that Marcel will be providing, there is some information about graduation rates. So 4-year graduation rates for Vashon was 53%, Roosevelt was 50%, and Sumner was 63%. So that is something that needs to be addressed. And to Alderwoman Hubbard's point, programs are great, but how do you get the most at-risk kids into those programs? How do you make sure that it's not the kids that have the social system to get them into after-school programs that are getting those slots? How do you really make sure that it's those kids that are most at risk? And so some of the things that the Youth Violence Prevention Partnership has invested in is street outreach. Go where kids are, an open gym and a recording studio at Mission St. Louis to get kids into Mission St. Louis, but then to have expectations that you go to school, you have a job, you create a resume while you're doing these recreational activities as well. Also, they've invested in mentoring as well. So we really feel that we are on the way, but there's no single answer to crime. There's no single answer to youth violence. And so, as Serena mentioned with one of the slides, there is plenty of work and plenty of solutions to keep all of St. Louis busy trying to reduce the crime rate.
A couple things. One, to address, I think we need to hold gun owners responsible, and I think this committee can do that. I'd like to see some legislation. I know it's been talked about, but if your gun gets stolen while you're out and you don't have a lockbox that's bolted to your trunk, you know, there should be some fine. I realize it can only be $500 in 30 days or whatever, but I do think, you know, as a committee, I'm hoping we address a lot of these things, you know, and gun safety being one of them. But I know you said you guys walked in Pam Alderman Boyd's ward.
Yes, we canvassed in the 27th ward.
Can you let us know what you canvassed about, how that worked, and how you got started to do that? And then after that, I think if Jimmy Edwards is still here, I might bring him up.
Serena, do you want to talk about how that came about? So that was when I was involved in the Violence Prevention Commission, but not currently the coordinator.
Right, so it actually started with us talking to organizations that do street outreach, trying to understand the best way to connect to residents who lived in areas that had high rates of violence. And they suggested that we actually go out and knock on doors and talk to people about resources that are available to them before an incident occurs, so that the community knows that we're showing up and that we care, not just being reactionary. So we reached out to Captain Perry Johnson, who's the commander for the 6th District. He also serves as the co-chair for our Community Engagement Committee, and we developed a strategy of inviting volunteers and institutional partners to go door to door on streets that had the highest levels of violence in his district, and passing out resources, so information about 211. We had someone there who on the spot could assist with issues such as utility assistance or rental assistance. And we also had city departments that went with us on that first canvas, so that when they got complaints from residents about areas that were overgrown or other built environment issues, that they could actually follow up on those immediately. So that structure is in place, and we're able to mobilize based on partnerships for those particular areas. So for the 27th Ward, it was really Captain Perry Johnson that helped drive that strategy. And then we always connected in with the Alderwoman to let her know what days we would be canvassing, where we would be, so that we could connect with anything that she had going on as well.
All right, follow-up question to that.
Oh, no, go ahead.
Yes, Serena, out of curiosity, do you know how many attempts versus contacts that you actually made when you were out door knocking?
We have that data, but I don't have it on the top of my head because we did the 27th Ward last year and we did Jennings this year, so it's just not fresh. I will say from my experience knocking on doors that maybe about half of the people that we knocked on came out. For those who didn't come out, we had door hangers where we just left information about 211. But I will say that everybody that opened their door and came out, they had something that they wanted to share about what was working and what wasn't working and what concerns they had, and they were happy to see us.
And about the average age of?
I don't think there was an average age. We talked to young people who were out riding bikes or working on cars. We talked to elderly people who had some concerns about things that were happening around their property. And I'm thinking, I went out with Vontrice, who was with the Live and Well, and from the doors that we knocked on, I would say that we had a range of ages, as well as folks who were retired, working. It was a pretty good range.
So were you doing a survey when you went out, or it was just casual conversation and you were recording?
Right, so we went out and we literally just knocked on the door and introduced ourselves. We asked people, had they heard about 211? Did they know that there were resources available if ever they needed some supports around food insecurity, shelter? We kind of gave a range of things that we could help with. No one that we talked to had ever heard of 211. They didn't know that we existed. They didn't know how to connect to resources. So they were happy to have that information. And then we asked them to tell us what their biggest concerns were in their community as it relates to violence and crime. And across the board, all of the responses were related to built environment. So as much as we kind of focus in on the actual acts of violence, people actually feel safe in their community based on what the community looks like. Whether or not they feel like it's being taken care of, and whether or not they feel like they are a priority. So just going out saying, what can we do to improve your community? We got a lot of responses around built environment.
Did you leave anything behind?
We left behind information on 211 so that people could contact us. In some cases, I would pass out specific information about an agency. There were a few seniors who hadn't heard of the senior fund that just passed. So we gave information about that when it was appropriate as well.
Thank you.
So could you tell them what area you covered?
Off the top of my head, I know we did Beacon, Alcott, Davis or Davison, Thekla, Lillian, Thrush. So it was Walnut Park East. Yes.
Anyone else? Is Jimmy Edwards still here, or did he have to leave? Then, and what about Dale Glass? Is there anything you would want to add to any of this? Well, then I think.
One more comment.
Oh, yeah.
I'd like to just say it's just refreshing to have a presentation from a provider, quote unquote, that's not asking for money, but offering solutions. And that is greatly appreciated. And Serena, I really appreciate your comment about how there's just so much work for a lot of people to do, because that's something that I just keep saying. There's just hundreds and hundreds of people that could be doing the work. And some of the work is just communicating better with your neighbor, sharing resources, saying hello can change a mindset. So I just really thank you guys for the work. I thank the leadership of the chairman for bringing you guys forth, because when I met with you guys one-on-one, I certainly was interested in you guys sharing. I mean, everybody just needs to know about, what you're doing, and people can decide to do what they want to do with the information, but there's a lot of good information out here. There's, this is a piece of a plan, and people keep asking, what's the plan? What's the plan? What's the plan? Where here's just one of many that needs to be developed. And I think this is all a work in progress. I'm really inspired by the fact that it seems like this is really now on the forefront. I forget the phrase that my colleague from the 5th used, all hands on deck. I think what she said, because it's time. All hands need to be on deck, and we need to really care and love each other more, and share these resources, and just tell the world we can do better. Thank you.
Thank you.
If no one else, I was going to say, if there's anybody that's basically out in the group that did not get one of the presentations that want them, I'll go in the back and print some off. And I think we'll validate parking too.
Probably can.
Yeah, so if anybody drove and they're in the big giant parking lot, we'll validate your parking today. And thank you all for coming. So after that, we'll just move to adjourn the meeting. And again, anybody that wants a copy, please see me.